Chapter 6, Urinary System. So today we're going to be focusing on the medical terminology regarding the urinary system. The urinary system is composed of four main structures: kidneys, urinary bladder, ureter, and urethra. Here you can see that the urinary system, you have two kidneys, two ureters, one urinary bladder, and one urethra. Each kidney is found in the upper abdominal area, one on each side of the spine. Main function: filters blood to remove waste products and produce urine. The ureter, you have two of them. These tubes extend from the kidneys to the urinary bladder. Their primary function is to transport urine from the kidneys to the bladder. You have one urinary bladder located in the lower pelvis. It's a hollow muscular organ. Primary function: holds urine temporarily before excretion. Urethra. This is a tube that extends from the bladder to the outside of the body. Primary function is to transport urine out of the body during excretion. So we look at the process of excretion. Excretion is removing metabolic waste in order to maintain balance and preventing any kind of toxicity with the body. So when we think about metabolic waste, we can think about carbon dioxide, which is primarily eliminated by the respiratory system, but also you have nitrogenous compounds like urea, which is a result from protein breakdown and are usually excreted from the urine. And also another example of metabolic waste is excessive water and electrolytes, right? So again, too much of it can be toxic, and that is going to be removed primarily from the kidneys. Let's work on some word analysis and definitions. So here we have identify and define the suffixes. So nitrogenous, suffix us, meaning pertaining to. So the full definition: pertaining to nitrogen or nitrogen compounds. You have urinary, okay? Urinary, the suffix "ary" is pertaining to. Full definition: pertaining to the urine or the urinary system. Next, let's focus on identifying the roots. Here you have nephrectomy. Nephro is referring to the kidney. So nephrectomy is a surgical removal of kidneys. Renal root is ren, which refers to also the kidneys. Full definition: pertaining to the kidneys. Now let's compare these two specialties. You have a nephrologist and a urologist. Nephrologist is a specialist that focuses primarily on kidneys, only kidneys. These include chronic kidney disease, electrolyte imbalances, kidney failure. Whereas a urologist is a little bit more wide variety. This specialty focuses primarily on the urinary system. So this can include not only the kidneys, but also the bladder, urethra, ureter, and even the male reproductive organs. Now let's focus on the anatomy of the kidneys. The kidney is a bean-shaped organ located in either side of the vertebral column in the upper abdominal cavity. Their position allows them to filter blood efficiently and produce urine. The kidneys, there's going to be three primary regions of the kidneys. You have the cortex, the medulla, and the pelvis. So the cortex is referring to the outermost layer of the kidneys. This contains a nephron, which are the basic filtration unit of the kidney. You have the middle or medullary region. This contains these renal pyramids, where urine is collected and transported to the pelvis. And then the innermost region is going to be the pelvis. This is a funnel-shaped structure that collects the urine and directs it into the ureter for excretion. So here, what is the primary function of the kidneys? We said before, kidneys filter excess water and waste, like urea, electrolytes, excessive water, like we mentioned, from the blood, excreting them as urine to maintain homeostasis. One thing really important is it's a primary role of regulating water, salt balances, and also, which again, when you put it together, blood pressure. So where are these nephrons? And what do they do? Now, when we look at nephrons, nephrons are referred to as a functional unit of the kidney, and their primary location is going to be in the renal cortex, and their main role is, as mentioned before, is filtration. Nephrons filter blood, remove waste, and produce urine through a series of complex steps involving the glomerulus and the convoluted tubules. Here are the general functions of the kidneys. So I'm going to go through these. So the kidney is responsible for filtering blood to remove excessive waste and water products. These are excreted in the urine, help the body maintain balance, and eliminate toxins. The kidneys also regulate blood volumes by eliminating or conserving water when needed. What happens when the kidney is conserved too much water? Well, the kidney plays a vital role in homeostasis by controlling how much water and electrolytes like sodium and potassium are eliminated. This ensures proper fluid balance to prevent issues like dehydration or electrolyte imbalances. It also secretes renin. The kidney secretes renin. Renin is a specialized enzyme that is responsible for regulating blood pressure. What else? You have erythropoietin. So secretion of erythropoietin is a specialized hormone in the kidneys that's responsible for a process called erythropoiesis, or the production of red blood cells in the bone marrow. This is especially important in order to ensure adequate oxygen to deliver throughout the body. The kidneys also synthesize vitamin D, which helps regulate blood and bone calcium levels. This is crucial for maintaining strong bones, proper muscular function, and overall calcium balance. Here, let's focus on the anatomy of the nephron. So nephron, like I said before, is the functional unit of the kidney, and it consists of the glomerulus, Bowman's capsule, loop of Henle, distal and proximal convoluted tubules, as well as collecting duct. The kidney forms 45 gallons of filtrate a day, containing water, urea, glucose, electrolytes, and amino acids. So what is filtrate? Filtrate basically any substance that moves from the blood into the kidneys. So when you think about filtration, blood to urine. Over 90% of water and filtrate is reabsorbed into the body as it passes through the renal tubules. Structures in the nephron, including the proximal convoluted tubule, the distal convoluted tubule, loop of Henle, and collecting duct, will be responsible for this process of reabsorption. Let's change the following terms into plural forms and define them. Okay, you have calyx, plural would be calyces. This is basically a structure found in the kidneys, and they're basically chambers that collect urine. Cortex, cortices, it's plural. This refers to the outer layer of an organ, like the kidney or the brain. Glomerulus, so the plural would be glomeruli. This is a group of blood capillaries that are responsible for filtering out blood and transporting filtrate into the urinary system. Hilum or hyla, this is the area of organ where the vessels and nerves enter or leave. Now let's focus on the urinary bladder and the urethra. So urinary bladder is this hollow muscular organ located on the floor of the pelvic cavity. The urethra is a hollow tube that extends from the inferior aspect of the bladder to the outside of the body. It varies in length, about 1.5 inches in females and about 8 inches in males, reflecting anatomical differences. The bladder stores approximately 200 milliliters or 7 ounces of urine before the process of micturition or urination. The urethra transports urine from the bladder to the outside via the external urinary meatus. When we think about micturition, micturition is a process of releasing urine from the bladder or just urinating. This occurs when the internal and external sphincters at the base of the bladder relax, allowing for the urine to flow out the urethra. Word meanings. So here, you're going to state the meaning of the following terms. You have meatus is the external opening of a passage, such as urinary meatus, where when urine exits the body. Sphincter. Sphincter is a band of muscle that encircles an opening, controlling its closure and relaxation. Example, internal and external sphincters of the bladder controlling the release of urine during micturition. Micturition, urination, void. These terms all mean the same thing, and it primarily is defined by to expel urine from the body via the urethra. So this process is essential for removing waste and maintaining fluid balances in the body. Now let's look at disorders of the urinary system. So here you have renal cell carcinoma. This is a malignant kidney tumor, and these symptoms that will basically characterize this is hematuria, or blood in the urine, as well as flank pain. You also have Wilms tumors. These are rare childhood kidney cancers that are present with abdominal swelling or mass. You have benign kidney tumors. These are non-cancerous growth, often asymptomatic unless large or obstructive. Hematuria, like I mentioned before, this is referred to as blood in the urine caused by infection, stones, or tumors. You have acute and chronic glomerulonephritis. Acute is sudden glomerular inflammation. Symptoms include hematuria and swelling. Chronic glomerulonephritis is a long-term glomerular damage and may cause proteinuria, basically meaning protein into your urine, and high blood pressure. Nephrotic system. This is an excessive protein loss in the urine, and the symptoms include edema and proteinuria. Interstitial nephritis. This is the inflammation of kidney tissue, often due to drug or infections. Disorders of the kidneys. More of this. So pyelonephritis. This is a kidney infection that caused by bacteria, and the symptoms include fever, flank pain, and frequent urination. You have primary hypertension, high blood pressure without the identifiable cause, a major risk factor for kidney disease. Polycystic kidney disease. This is a genetic disorder causing fluid-filled cysts in the kidneys, leading to kidney enlargement and dysfunction. You have acute renal failure. This is a sudden loss of kidney function and the primary causes include dehydration, infection, or toxins. Chronic renal failure. This is a gradual decline in the kidney's function over time, and these symptoms can include fatigue, swelling, and anemia. End-stage renal disease, ESRD. This is a complete loss of kidney function, and these patients primarily require dialysis or some kind of kidney transplantation. Let's do some disorder definitions. So state the meaning of the following term. Anuria, the absence of urine production or output. Azotemia, elevated levels of nitrogen-containing compounds, for example, urea, in the blood. Hematuria, the presence of blood in the urine. Oliguria, this is a reduced urine output, typically less than 400 milliliters per day. Proteinuria, this is the presence of excess proteins in the urine, indicating kidney dysfunction. Uremia, this is a toxic condition caused by a buildup of urea and other waste products in the blood due to kidney failure. Let's look at disorders of the ureter. Nephrolithiasis, kidney stones. This is the presence of these calculi, which begin in the pelvis of the kidney and as a tiny grain of undissolved material, often referred to as calcium oxalates. As urine flows out of the kidney, this material is left behind. Over time, more material is deposited and the stones will begin to form. Most stones enter the ureter while small enough to simply be passed into the bladder and move out of the urine. This can become lethal unless treated upon by either some kind of medical intervention. You also have a term, hydronephrosis. Hydronephrosis occurs when a stone is lodged into the ureter, blocks the flow of urine, and because of that, this backflow pressure causing the renal pelvis to dilate. Disorders of the urinary bladder and urethra. So you have UTIs, urinary tract infection, that occur when bacteria, often E. coli, invade the urinary tract through the urethra. Diagnosis of urinary tract infection is made through urinary analysis, and the treatment of urinary tract infection usually refers to some kind of antibiotic. Now, here you have something called urinary incontinence, which is a loss of bladder control. The four types of urinary incontinence are stress incontinence, urge incontinence, overflow incontinence, and functional incontinence. Urinary retention is the abnormal involuntary holding of urine in the bladder. Urinary retention can occur due to obstruction, neurologic problem, as well as a side effect of medicines. Bladder cancer is more common in men than in women. The most common type of bladder cancer is transitional cell carcinoma. So let's look at diagnostic procedures and pharmacology regarding the urinary system. So here you have these diagnostic procedures. Primarily, it's going to be a urinary analysis. In the urinary analysis, they will have a sample taken for a sample of your urine taken for analysis. Urinary analysis can be used to diagnose UTIs. You can screen for disorders in other types of the body and diagnose disorders in other body systems as well. Routine analysis involve visual inspection and the use of these urine dipsticks. When we look at this figure, you can basically compare the presence or absence of products or polymers that may cause some kind of pathology. So they can refer to as visual observations, the odor, the pH, specific gravity, presence of protein, presence of glucose, presence of ketones, presence of immune cells like leukocytes as well. And also there's microscopic urinary analysis, which involves visual inspection of samples of urine sediment using a microscope. Other diagnostic procedures that we can use here. So KUB is an X-ray of the urinary system to use to diagnose obstruction or some kind of mass. Intravenous pyelogram, IVP, this used a dye contrast that's introduced into the bloodstream, and there's a rapid X-ray. Retropyelogram, this uses dye, a radioactive dye, to introduce through the urinary catheter to locate calculi and other obstructions in the ureter. You have voiding cystourethrogram. So this is a physiologic examination used in order to monitor the kidneys during urination or micturition. You have Computed tomography, CT, is used to show cross sections of the kidney and bladder to test for anatomical problems. You have MRI, magnetic resonance imaging, used to look at different parts of the tract. Ultrasound, renal angiogram. Renal angiograms use a dye to basically look at the vascular network of the kidneys, and cystoscopy. Cystoscopy is an endoscopy used to examine the lining of the bladder. And here we have different methods of urine collection. For example, you have random collection, so urine is collected at any time of the day without any specific preparation. You have early morning collection, which is collection during when you wake up. Clean catch midstream specimens. This is collected midstream after cleaning the external genitalia. 24-hour collection. You have all urine is collected over a 24-hour period. You have suprapubic transabdominal needle aspiration. This is a sterile needle is inserted through the abdominal walls into the bladder, used when contamination must be avoided, often in infants or specific medical conditions. Catheterization. This is a sterile catheter is inserted into the urethra to collect urine directly from the bladder, used for patients unable to void naturally or when a sterile sample is required. When we look at terminology, terminology here is the stating this. I want you to hear to state the meaning of each and what do they have in common. You have glucosuria, presence of glucose in the urine. You have ketones, is a of presence in the urine of the chemicals formed when the body is experiencing starvation or uncontrolled diabetes mellitus. And you have nitrite. Nitrite is a chemical formed in the bladder in the presence of bacteria. They are all found in the urine in different diseases. That's how you can characterize how they're in common. You have therapeutic procedures. So you have renal stones. For example, for renal stones, there can be watchful waiting, extracorporeal shockwave lithotripsy, where they use sound waves to break up, ureteroscopy to monitor the stone, percutaneous nephrolithotomy here. These procedures, and as well as open surgery, are basically used in order to treat and monitor someone having some kind of renal calculi or renal stones. Nephrectomy, when we look here, you have nephrectomy that is basically used for different variations. So, for example, surgical removal of the kidneys. This can be radical, donor, or even partial. So, people that having kidney failure, what is the primary use for them? They have dialysis. Dialysis basically is a form of artificial filtration in order to purify the blood. Okay, so there are different types. You have hemodialysis, peritoneal dialysis, continuous ambulatory peritoneal dialysis, and continuous cycling peritoneal dialysis. And if these do not work, the patient will basically be required some kind of kidney transplant. Okay, urinary bladder problems. We use cystoscopy. Basically, we use an endoscope in order to look at the lining of the kidneys. Here are the different types of dialysis, right? So again, dialysis is a treatment for renal failure. Dialysis is a process of removing waste and excessive water from the blood. Hemodialysis involves the filtration of blood through a dialyzer, which is basically a artificial kidney. Peritoneal dialysis uses a dialysate that is infused into the drain from the peritoneal cavity. You have continuous ambulatory peritoneal dialysis is performed in patients at home, usually 4 times per day, 7 days per week. Continuous cycling peritoneal dialysis is used a machine to perform peritoneal dialysis while the patient is asleep. Word analysis. So here I want you to identify combining forms and suffixes of the following terms and define them. Lithotripsy, combining form litho, suffix tripsy, definition, to crush a renal stone using sound wave. Nephroscopy, combining form nephro, suffix scopy. This basically is defined as to examine the kidney. The ureteroscopy, combining form uretero, suffix scopy, definition to examine the ureter. Here, we're going to be focusing on pharmacology. Pharmacology in the kidneys is primarily going to be involved with diuretics, renal drugs, non-renal urinary tract drugs, drugs for STDs, sexually transmitted diseases, prostate drugs, and other non-renal urinary tract drugs. Diuretics' primary responsibility is increasing urine output. Renal drugs are used to treat a variety of urinary conditions. So there could be a lot of different, whether it's nephrotic syndrome, renal cell carcinoma, renal transplant. Non-renal urinary tract drugs include antibiotics, urinary analgesics for pain, and alpha blocking agents for relaxation of smooth muscle. Drugs for STDs include metronidazole for trichomoniasis, azithromycin for chlamydia, and IM penicillin for syphilis. HIV infections have no cure and are highly active. There are highly active antiretroviral therapies. Prostate drugs are used to treat prostatitis, inflammation of the prostate gland, or benign prostatic hyperplasia, as well as prostate cancer. Other non-renal urinary tract drugs include drugs for erectile dysfunction and urinary incontinence. Here, lastly, I want you to define the following abbreviations. Here, ARF, acute renal failure, a sudden loss of kidney function. CAPD, continuous ambulatory peritoneal dialysis, a form of dialysis performed manually several times a day without a machine. CKD, chronic kidney disease, a gradual loss of kidney function over time. CRF, chronic renal failure, which is an advanced kidney disease leading to a loss of function. ESRD, end-stage renal disease, is a complete kidney failure requiring dialysis or transplantation. PKD, polycystic kidney disease, is a genetic condition characterized by fluid-filled cysts in the kidney.